Good morning.
Good morning. I apologize. I was having some technical difficulties, had to get on a different computer.
We're all adjusting to this this Zoom world, and
That's true. I
yeah.
don't know
So
why my
just
my
to
computer just didn't want to wake up this morning, apparently.
for your awareness, we are since this is a public meeting, we're streaming live to our YouTube channel.
Wonderful.
I don't show anybody watching except for me.
It's a
So
little early yet.
yes, but it will be available out there. So
Yeah,
now I'm
that's
going to
great.
close it because I can't stand to watch myself.
I know, that's the worst.
Commissioner Richardson is here in his office right around the corner. And
Hi, Commissioner.
I don't know if Sam is going to join us this morning, but we do have 30 minutes, so I want to make sure that we get
Yeah.
rolling. Chris, you're muted. Oh, and here comes Grant.
Okay, I think Sam was working with the other two commissioners to get them on.
Good.
All right. Well, this is really just kind of informal introduction to kind of the work that I'm doing. As you know, Commissioner, I was the mayor of Thornton for 8 years, and I was recently term limited. So I was working on opioid stuff as an elected official from more of a policy perspective, and just got really involved and active even at the national level with U.S. Conference of Mayors. Did a lot of research. I decided to get my degree while I was the mayor. So I got actually 2 degrees while I was the mayor, and used that to study opioids as well as marijuana. And, as you can imagine, marijuana research was kind of few and far between. So I focused a little bit more on opioids. So that's kind of my background. And when I saw this job pop up with the Attorney General's office, I thought, well, gosh, this is like the perfect job for me. And luckily Phil agreed with that. So, hi, Sam. So basically the reason for my call is that we are, as you know, we've sued the Purdue Pharmacy or pharmaceutical company. That was under Cynthia Kaufman's leadership. And then when Phil came on as Attorney General, he amended the lawsuit to include the Sackler family. So we have one lawsuit going right now that our opioid litigation team works on daily. And that one is a little bit more complicated because Purdue has filed bankruptcy, and then the Sackler family moved a bunch of money. And so we're working on trying to figure out how to get, money from them. And then we're also working on a settlement negotiation with Johnson & Johnson and some of the other larger distributors. And that is going to be a lot faster coming. We anticipate, and everything can change in the world of legal, especially in these weird times. But we anticipate settling probably within the next 6 to 12 months. That money will come in over 18 years. A portion of that money will go directly to the political subdivision, so you all will receive money from that settlement. And that money is really not restricted. So if you wanted to use it to fill potholes, you certainly could. We obviously are encouraging the subdivisions to use that money for opioid abatement, but you do what you have to do. A portion of that money will also go to the state, and then another portion of the money will go for abatement. The way that looks right now is it's 70% to abatement, and then 15% and 15% to the state and local subdivisions. So the abatement money will likely be managed by a third-party administrator. Our office will likely be the ones who kind of oversee the grants and make sure that everything gets done appropriately. We're going to be looking at kind of 3 different buckets in which to use the money. So prevention education, obviously we want to prevent our next generations from becoming addicted to opioids. So we want to make sure that folks understand the cause. As you all probably know, you can have surgery and get too many opioids prescribed to you and find yourself addicted. This happens all the time. About 85% of people who are doing heroin say they started with opioids. So it's a real problem, and it's something that we can prevent. So that's one bucket of the money. The second bucket is for treatment, really increasing access to treatment. Right now, 30% of people who are looking for treatment options are getting it. the other 70% of people looking for treatment options are not finding it for a myriad of reasons, whether it's financial or just a lack of resources in general. And then the third bucket is recovery. Recovery is really a pretty integral piece of opioid treatment. Studies show that it takes a couple of years for your brain to get back to normal, which is why we have so many relapses in this world. And it's really frustrating for those of us who haven't been through that or don't understand it. It's, you know, and you had the mentality of pull yourself up by your bootstraps and just, you know, stop doing it. That doesn't really work. And we want to work really hard to, number one, reduce the stigma around substance use disorder, but also try to figure out how to make this more of a community effort. So one thing I've been doing with the Prescription Drug Consortium over at CU is we're reaching out to the faith-based organizations. So if you folks have anybody in your faith-based communities that you think would be interested in this work, I've got a coalition that I'm putting together to provide resources and help to our faith-based organizations. And this is a very broad reach of faith-based organizations. It's everything from the Christian churches to the Muslim churches to the Jewish community and so on and so on. So we're very much reaching out and trying to figure out how to get help from our community members. We have a toolkit that's available for not only faith-based organizations, but also community centers. That would range anything from having meetings for providing safe places where people can recreate without, you know, the challenges of having drugs there. And then also, you know, places where there are meetings available and peer support and that sort of thing. We're also looking at using the funds for some type of tuition reimbursement or loan forgiveness, student loan forgiveness for people who want to get into the addiction counseling world, because we have a huge shortage. I don't know what it's like in your community, but we have a real shortage of workers in this area. So finally, we want to look at criminal justice issues. How do we make sure we have medication assisted treatment for folks who are in jail? We know, and it's probably no different in your county, that people who are in jail often have some sort of substance use disorder as well. And if we can get them, you know, in treatment and started while they're incarcerated, when they come out, if we can continue that care, we have a much better chance of keeping them out of our jails and obviously saving us some money. So there's a criminal justice aspect. We're looking at it. We're looking at how do we reduce harm for those folks who are using. So providing a place for them to pick up, you know, new syringes. Also how to dispose of their syringes so that they're not leaving them in the parks or in the alleys and that sort of thing. So there's a whole bunch of things that I'm working on. I'm putting together a white paper and hope to be able to start sending that out your way in the next few months. And the last thing I would say is that I'm looking for collaboration. This money will come in over 18 years. So as you can imagine, it won't be enough to solve the problem. And so, you know, to the extent that there are foundations or nonprofits or treatment providers who would like to talk to me and tell me a little bit more about what's going on in your communities, I would love to have those connections. I'm really trying to make my way around the state. And as you can imagine, it's a little more challenging doing that via Zoom. So I'm really looking to you all to help me make those connections. So at this time, I'd love to just, you know, answer any questions you might have and also hear from you what kind of challenges you're having in this area.
I'll jump in because people stay silent on Zoom and it gets awkward. No.
It does.
Hey, as we rolled into the issues with COVID, we were kind of in the final stages of collecting data for the healthcare, public health assessment of issues in the county to renew the assessment. Yeah, and I know we put that on pause because we probably do have other issues now with COVID and we'll be redoing. So that's probably the best place for us to get a look at what our specific issues are and how prevalent that is a concern in the community. I know we haven't been as impacted as many to the farther east of us, but certainly we've been seeing impacts.
I'll jump in next. Hi, Heidi. Dwayne Smith. I'm the Public Health Administrator for Elbert County. My first thought in this conversation is I worked in local public health in South Carolina during the big tobacco settlements and saw how that windfall was, gosh, the vast majority of it, if probably not 80% of it or more, was used to patch budget shortfalls among all state agencies and departments. Very little of it went to actual tobacco prevention work. So I commend your efforts to make sure that this settlement money, to the extent possible, is allocated and dedicated to opioid response, and particularly the upstream prevention components of it for the next generation. So by way of curiosity, do you have a sense of what other rural communities are doing or perhaps planning to do when it comes to, and not just Colorado, but perhaps other states, what they would like to see done or hope to see done? And just for context, in the event you didn't know, Elbert County does not have a hospital. We've got one family practice that I believe has 3 DOs. We've got one location, Peak Vista Community Health Center. So we have very little in the way of infrastructure and no emergency care, virtually no acute care, and no addiction and recovery resources in terms of inpatient that I'm aware of. So.
Yeah, so I'll tailor it a little bit more to that. What I'm hearing from the rural communities, especially those that don't have the infrastructure, is that we have to figure out a way to use this money wisely. So one of the ways that my office is thinking about this is to put us into regions. And I was kind of looking at the MSO map as the Managed Service Organizations map, as maybe a way to start this conversation of how do we break into some regions. That way, you know, if we look at Elbert County and you do it by population and the impact, you guys probably won't get a lot of money. But if we look at it from from a broader perspective and put you into a region, you know, Northeast Colorado, there's going to be a lot more opportunities for a larger pot of money to go to your region. And then rather than just throwing a bunch of money at it and saying, here, solve your problem, how do we look at the rural areas and say, we need to build some infrastructure first? So we need to figure out what that looks like. What do you need? What are the things that Elbert County could use? Or are you guys really relying on a different county for services? And how do we help you work better with those, with you know, the people in your region? So for example, there's a lot of, and I'm sure you've heard of this, Dwayne, these hub and spoke models that are popping up around the country. Larimer and Weld have done this. It's called their COSLAW model, which is a weird acronym, but it's Colorado Opioid Synergy Larimer and Weld is what that stands for. Dr. Leslie Brooks is one of the folks over there that are that's involved in that. And basically what it is there's a hub, which you all don't really have, but maybe you have one in a neighboring community. So it's usually a hospital or some organization that can handle a case that needs more comprehensive care than just substance use. And so this might be an individual who has trauma, who has some also underlying health issues, but also has substance use. And so they're starting this hub, and then they have spokes that really are kind of the more specialized treatment providers for whatever needs these folks have. And COSLAW actually applied for a grant through SAMHSA, which is a federal agency that deals with substance abuse. And they provided navigators. I always forget the term of these folks. And the navigators get assigned a certain amount of people, and those people are not dropped through the cracks, right? This is what happens a lot in this world is folks they just fall through the cracks and go right back to their behaviors because they don't have any accountability and they don't have anyone to call. And a lot of people don't even know how to get to treatment. I have a son who had an addiction problem, and I'm a middle class person. I was on the school board. I was fairly connected, had no idea how to get him treatment, right? So this isn't just a problem for people who have low resources. This is a problem we have just in general in our society because the resources are very limited. So these navigators then take people and make sure they get treatment, and they have a much better success rate. And then if you can kind of add that to our community, like our faith-based organizations or our community centers and so forth, where they have a place to go that's safe, that they're not going back into their regular environment. These hub and spoke models seem to be working. I will tell you that I think they will work differently in different parts of the state because we all have different things going on. Obviously, they'll probably be really successful at the metro area, and we'll have to put more money and more resources into it at the rural areas. But that's one model I'm looking at that I think, would be something we would propose, but we're not. One of the reasons why Phil hired me is because I am an avid local government supporter, and I'm never going to go into your community and say, this is something you should do or you have to do. I'm going to say, what do you guys think? What are the needs and what are the resources you have? And let's work on that. So those are the kind of things that I'm hearing from rural areas. The other thing I'm hearing probably more in your area is that there's more issues with meth than opioids, heroin, that sort of thing. This money won't be used on meth abatement, but you certainly could use your 15% on meth abatement. What I'm trying to figure out is if we have a meth and an opioids problem and I have money for opioids, who is it that wants to help with the meth issue? And maybe we can partner that money together. And again, bringing resources together in the local governments, we're all pretty scrappy. We can figure out how to form partnerships and how to bring money together. And that's what I'm looking at doing.
Thank you. You touched on a couple things there that I liked. I previously worked at Children's Hospital, so we had health navigators assisting families in a variety of capacities, and also, the cooperative care agreement, because of our lack of infrastructure and resources, just making sure that there is equitable access to treatment and recovery programs is, if that can somehow be facilitated. Most of our folks that need acute care for whatever go to Douglas County, either Castle Rock or Parker.
Okay.
So.
Yeah, that was one question I was going to ask you is where do you go when you have those issues? And I think, one of the concerns I hear from the rural communities is, that's great if you put us in a region, but is the money going to stop at whatever big city it is? And that's a good question. And I think that that's up to you all, once the regions are formed, to really put together some working groups where you're asking those questions and you're figuring out how do we get access to those services. And maybe it's telehealth. That's a huge benefit I think that we're getting from COVID is that we're learning this, but we're also figuring out truly where we have gaps in technology access for folks. And so if we can address that, and that's one thing the Attorney General is addressing is broadband at a big level now. There's about 39 attorneys general around the United States that are doing this. If we can get better access to technology, we'll be able to really work with people a lot better through telehealth and other technological advancements. So
I'm a big fan of telehealth, especially as it relates to behavioral health issues.
Yeah.
I think that's our easiest path forward, although it's not an easy path. So the most fruitful path forward, perhaps, is a better way of saying that.
Exactly. Well, I think we're finding that people feel safer in some instances, and in other instances, it's like, well, gee, I don't have any privacy. And so we have to, it's not a one size fits all. And that's the challenge with this issue is that everybody needs something a little bit different. And so that's what we all have to try to figure out. And that's why the elected officials and the people who are on the front lines providing treatment, you are the folks who have to figure out what's right for your community.
And then lastly, and I'll shut up, with regard to the regions, if there's any way that we can facilitate through your office or other state agencies, smaller regions, it's kind of tough when we're lumped into the same region with, Sedgwick and some of the far northeastern counties. We'd, I think, prefer to have maybe a smaller Eastern Plains region, if that is possible to facilitate.
I think anything's possible right now because I'm really just trying to figure out what works best for the state. Obviously, for me, it would be easier if I had less regions to kind of manage. But at the end of the day, if that's not, if that doesn't work well for you all, then it doesn't really matter what makes it easier for me, right? Because we want to make sure you guys are getting the help that you need. So I will definitely make a note of that. And there's a way to look at that MSO map and then break it into a couple. And so Dwayne, I would love to have your contact information if maybe Eileen could send that to me, and maybe we can talk a little bit offline about that.
Yeah, thank you.
Absolutely. Any other questions? All right. Well, I appreciate you all. Eileen has my contact information. I know the commissioners have my information as well because I emailed you. Feel free to reach out at any time. One thing I will tell you that I forgot to mention, which is probably the most important thing, is that when we get closer to the settlement, and I have more information for you, I'm going to need every county and every town and every city to sign off on this lawsuit. It's a protection for the distributors so they don't have future lawsuits. We don't have to like it, but we will have to sign off. If we don't have sign off, we'll lose money. So there's basically these big, huge bonuses for sign off. And so my goal is to get 100% of our towns and cities and counties to sign off. And so when that time comes, I'll be calling you, or you'll be getting an email from CCI, and we'll be asking for your help on that with your communities as well. So it's kind of like running for election, like you're selling something, but you don't really know what you're selling yet. So hopefully that'll come sooner rather than later, and I'll be able to reach back out to you all and let you know what we're looking at.
Well, thank you, Heidi.
Yeah, thank you. Thank you so much, Commissioner Richardson, for setting this up. You all have a wonderful day, and let me know if you have any questions.
Thanks.
Thanks. Bye. Yeah.
Take care. Thank you. Bye-bye.